Hi all, my name is Feda. Today I will show you about my school, and I will introduce you what PBL or problem-based learning looks like in my school. This is the map of the location of my school. My school is located in south of Jakarta and has established since 22 years ago, since 1993. We are located in quite crowded environment. So this is the complex of our university. We are quite close with the law faculty, economic faculty. This is the building of School of Medicine. University has 7 faculties. Before 2014, it was a private university under an Army Defense Ministry. The last curriculum revised in 2006 and changed into competency-based curriculum. The curriculum adopts the SPICES model, student-centered, problem-based, integrated, community-oriented electives with a core curriculum and systematic. The total credit in undergraduate programs are 156 credits. 30 credits are local content. We call the main course as a section that usually runs for 7 weeks and 1 week for examination. In the first semester here, there is a FBS, Fundamental Basic Science 1 and 2, and also 3 and 4. Our curriculum is built on competency. In the second year, the content is more complex, such as cardiovascular system and hematoimmunology system. The third year is genitourinary system, neurobehavior system, endocrine metabolic system, and reproductive system. Fourth year, the student learn forensic, field medicine, and also thesis writing. Soft skill is more developed during the bioethic humaniora program 1 until 4, and also in leadership, in citizenship, Indonesian language, English language, and also Pancasila is as our ideology. We also have clinical skill program that students learn and demonstrate clinical procedures from semester 1 until semester 7, and also community health oriented program to support government program heading to sustainable developmental goals, expand from semester 1 until semester 7. So we adopt vertical competency-based curriculum. How the students enter to my school? Every year we accept 150 students. There are 3 streams about how they enter, or 3 different selection process. 150 students come from invitation-based university. 50 students come from national entrance exam, more objective selection based on merit, and 50 students are full-paying students. I would like to explain more about the method of teaching in one course. Suppose the neurobehavior system course. One course duration is 8 weeks minus 1 week for examinations. The activities are problem-based learning, 2 hours twice a week. Lecture synchronous 2 hours is about 25 times in 7 weeks. Procedural skills learning 3 hours each week. Laboratory activities, whether anatomy, physiology, biochemistry, clinical pathology, histology, clinical anatomy, biology, is 3 hours for each week. Then comes to see how we do our PBL. Let us see what situation looks like in PBL in my school. PBL method for over 50% of all teaching and learning activities during the 7.5 semester of medical students' preclinical education. In preparation for the preclinical PBL, students receive training on PBL. Students attend all PBL sessions with a fixed tutorial group. A group is consists of 10 until 11 students. Tutors who are assigned to each group also receive training on how to facilitate PBL and are provided with a facilitator's guide. The clinical cases presented in each week are stratified in complexity based on the level of competency that the students want to achieve. The PBL are held in 2 sessions and adopt 7 JAM methods of Maastricht University. Students sometimes do not know the topic of each week and the first day you started with pray together and introduce each other and also decide who will be the scribe and who will be the group leader. The student will work in a group, read the case together, define the problem and looks for unfamiliar terminology. The brainstorming process is quite short because most of them has no prior knowledge. And tutors also find really hard to activate their prior knowledge and stimulate discussion. The group then formulates the learning objectives and the tutor gives approval or add some LOs. The students then divide their LOs. The first day of PBL is usually shorter than the second day. It only happens for 1 hour. It's from 2-hour session. The next day, students work independently to achieve their learning objectives. And the day after tomorrow, they gather in a group and one student shares their learning objective or their topics and the other students will listen. In the end of his presentation, the other student will ask questions. They present their topics with the help of the PowerPoint software that displayed in a big monitor in class. But after the presentation, the questions sometimes are not many, and the discussion sometimes is not happening. Not all students are participated in a discussion. But also because of the high content of the LOs that students present, the duration of the second day of PBL is longer. It's about 3 hours or more because one student presents about 20 minutes. Sometimes they are lack attention because they are busy in preparing their own LOs, or they're getting bored, or they fall asleep. Regarding the tutor, there is a short 15 to 30 minutes briefing regarding the each week case. The tutor gets the hands out in the morning of the PBL or 1 day before the PBL. So it's difficult for tutor to get well prepared for each week. However, the tutor usually attend the briefing before the PBL. The hands-out also contains the set of learning objectives. The LO are usually ranging from anatomy, physiology, histology, embryology, pathophysiology, diagnosis of the case, symptom, laboratory findings, imaging findings, treatment, and the differential diagnosis with the same approach. Regarding how the students feel about our PBL, sometimes the topic is not the same as in the schedule. They have difficulties in updating the topic each week. And the schedule for other methods changes a lot, such as lectures, skill procedure, or laboratory procedures. However, this PBL motivates the students, but on their own LOs, learning objectives. However, they cannot understand the other students' LOs. They said their presentation should be deep. This is the reason why they have no time to master their friends' LOs. And the students are not able to tell how is their progress during the course because they only master the LOs that they present. They said that the contents are too heavy for students. The students do not have the strict guidance what should be stressed about. For example, if they want to prepare for the presentation, it takes too much time and they feel it is too time consuming because they have no ideas which one is important, which one is not. The tutors also have different way to get the discussion. They said that they feel bored in the second day of PBL, and because they only master the LOs, they feel less confident in their course, and their materials are too much. Regarding the oral assessment, they have no ideas what is important. The examiners also have different questions. The students feel too much time to prepare for the examination. Regarding how tutors feel about PBL, tutors attend the briefing and reading the literature. Student attention fell less, especially during the pandemic event. They said that the first day attention is better than the second day attention. They said that maybe because the students are busy in preparing their presentation. Some students do not turn on their camera. Some students are not in place where the tutors call the students. And not all students participate in discussion. Many just keep silent and talk during their own presentation. The students have no ideas about their progress in the PBL. The resume of PBL in my school, it is the 50% of method of teaching, and the students communicate well, respect each other. However, the discussion is not quite active, and the assessment of PBL is in form of oral cognitive assessment. Thank you very much.